A 35-year-old man presents to the clinic with a 3-month history of progressive nasal obstruction, decreased sense of smell, and a feeling of facial pressure. He has no history of allergies or recent upper respiratory infections. On physical examination, there is bilateral nasal swelling, and a pale, bluish mass is observed protruding from both nasal passages. The patient denies nasal discharge or facial pain. His medical history is significant for asthma and aspirin sensitivity. What is the most likely diagnosis? A. Nasal polyps. B. Allergic rhinitis. C. Chronic sinusitis. D. Septal deviation. E. Wegener's granulomatosis. Please pause and write your answer in the comments. Now let's find the correct answer. Explanation. Nasal polyps are the most likely diagnosis given the patient's symptoms of nasal obstruction, decreased sense of smell, and the presence of pale, bluish masses in both nasal passages. The association with asthma and aspirin sensitivity, Samter's triad, further supports this diagnosis. Polyps are benign growths of the nasal mucosa, typically seen in patients with chronic rhinosinusitis and other inflammatory conditions. Why not the other options? Allergic rhinitis can cause nasal obstruction but typically presents with sneezing, itching, and clear nasal discharge, not with visible nasal masses. Chronic sinusitis would present with nasal obstruction and facial pain, but visible nasal polyps are more indicative of polyposis rather than simple sinusitis. Septal deviation can cause nasal obstruction but would not present with bilateral nasal masses or associated findings like loss of smell. Wegener's granulomatosis with polyangiitis, is a vasculitis that affects the upper airways but often presents with crusting, ulcerations, and systemic symptoms like hematuria, which are absent in this patient. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.